Today, we're talking about a question a lot of people with shoulder pain are afraid to ask out loud. Do I really need surgery? Dr. Dillingham is here to walk us through how surgeons actually make that call. Dr. Dillingham, when patients ask you, do I really need a shoulder replacement? What's the first thing you want them to understand?
Yeah, so for a shoulder replacement, we really want patients to be, bought in and know it's the right decision. So, in general, you typically know. So, if pain is bad enough that you can't do your normal daily activities, you can't sleep at night, this is really a quality of life procedure. So, when you're not doing all the things you want and it's impacting you, you're probably ready. And we like you to have exhausted all the conservative measures we have.
What are the most common shoulder problems you see that eventually lead to considering a replacement?
Yeah, so by far and away, the most common would be a big rotator cuff tear. The rotator cuff is the muscles that come over the top and attach and move the shoulder in place. If your rotator cuff is torn, the shoulder is out of alignment, so over time, you'll develop bad arthritis, which will equal pain. And then the other condition is just arthritis itself. Most people are really familiar with arthritis of the knee and hip because they've probably all had friends who have had knee or hip replacements. But shoulder is becoming more and more common as we continue to live longer.
Is there a typical age or patient profile for shoulder replacement, or is it more about symptoms than age?
So, mainly things are about symptoms. With that said, our body to some degree tends to wear out as we age. So, for most people, joint replacement, whether it's knee, hip, shoulder, occurs a little bit later in life. There's definitely an opportune time to have it. So, as I'm talking to a patient and we're trying to discuss if joint replacement's right for them, we try to decide what activities are you doing now? What do you hope to do in the future? If you're 70, it may be opportune to replace your shoulder now because it doesn't necessarily get easier to recover when you're 85 or 90. But that's an individual question for each person to sort of walk through because I will see people frequently that I think are 60 and they're 80 and vice versa. So it's not necessarily an age, but really a personal decision.
So, what signs or symptoms tell you that conservative treatments have been exhausted and it's time to talk about replacement?
Yeah, so common conservative things we do are like injections, physical therapy, laser treatments. When those are no longer providing any significant relief, meaning they're not getting weeks to months of relief from a shot, and then you can't sleep at night, it's probably the number one cause. Since shoulders, we don't walk on like we do knees or hips, but when we sleep, a lot of us roll around from side to side, which will cause tons of shoulder pain. If you're not sleeping, your overall quality of life really takes a hit.
So, how do you help a patient weigh ongoing pain and loss of function against the risks of surgery?
Yeah, surgery has come such a long way over the last multiple decades as far as what we can do and how effective it is. A lot of people are surprised to learn that in today's world, shoulder replacement is an outpatient surgery. You recover at your own house, in your own bed. There's medicines now that last a couple of days, so the shoulder is numb. So the majority of my patients, their pain level is probably no worse 2 to 3 days out than what they're normally living with.
So, how much does overall health or other medical conditions influence whether you'll recommend a shoulder replacement?
Yeah, so health conditions obviously are a big deal. We take them seriously. We usually get the patient's primary care doctor, cardiologist involved in the decision of whether they're healthy enough for surgery. With that said, most of our surgeries are all done with a block. So the shoulder goes to sleep, and even though the patient is lightly asleep as well, so they can remember things, the risk of anesthesia is much lower. Say, my general surgery colleagues who are operating on the belly, they have to put you in a very deep sleep, which probably one of the bigger risks is just anesthesia. So we can eliminate the majority of those risks by using a peripheral nerve block.
So, how successful is shoulder replacement overall in terms of pain relief and function? And how long do the implants usually last?
So, how long do the implants last is an interesting question because the majority of our data will be 20 to 30 years old where we were using totally different prostheses. So, it's kind of like asking, how does your 1990 TV compare to the one today? We think, and the goal is always that the prosthesis will last for your lifetime. But the older studies suggest 90% survival at 20 years. But we're hoping that the techniques we're using now is even better than that.
So, before we wrap things up, is there one piece of advice you would offer to help a patient that is on the fence to make a confident, informed decision?
Yeah, I think the most important thing is just coming in and gaining information. So obviously, there's a lot of information out there on the internet and friends, word of mouth. But it's never a bad idea to just sit down and kind of go over your options and make sure you've explored everything. But I would say in general, most people know. Like when I first started doing this, I would always be surprised when somebody would come in and they'd be like, I want my shoulder done like right now. And I'd be like, really? But then you find out they've been dealing and weighing with decision for years, but maybe we're afraid to even come in and talk to somebody about it.
Well, thank you, Dr. Dillingham, for breaking down when the total shoulder replacement surgery truly becomes necessary. I'm sure there are a lot of patients that will appreciate your guidance.
Thank you.